So welcome to the show. I guess we've kind of started making these into kind of our shows that are happening at Treehouse almost every 2 weeks or even weekly now. So I'm very excited to meet you and to have you on the show. For everyone who doesn't know me, my name is Julia Slanina. I'm the founder and CEO of Treehouse. At Treehouse, we build technology that is there to support allied health providers who support their clients from preconception all the way to early childhood. And part of the work that we do is very much committed to providing people from across Canada incredible, trusted, vetted, and evidence-based information. So joining me today is Brady Hutton. She is a registered dietitian at Push Mama Care. So Brady, she works with new and expectant mothers in order to ensure that all of their nutrition needs are being met, and she believes in the importance of using nutrition as a tool to help both mama and baby. So she supports their health and quality of life during fetal development, postpartum, and beyond. So today our topic is nutrition, managing fertility, and Pcos. So welcome to the show, Brady.
First of all, thank you so much for inviting me to join. I'm really excited to talk about nutrition and the role that it plays in managing PCOS and fertility, because this is a really new and evolving area of research that we're looking at here. So I'm really excited to dive into our questions for today and make sure that everyone has the information. I love that you mentioned that Treehouse focuses on evidence information, because that is definitely what we're about at Push as well. So everyone has the right information to really make informed choices. So I'm really excited to dive in for today.
Yeah, and that's a really good reminder. It's about making those informed choices for whatever your family needs at that time, or what your body needs, or what you need as a parent or expectant individual. So let's start off with, some people call it PCOS, some people call it Pcos. It's polycystic ovarian syndrome. What is that? Do you want to break it down for us?
Yes, absolutely. So PCOS, or polycystic ovarian syndrome, it's an endocrine disorder. It's one of the most common endocrine disorders that affects premenopausal women. So overall, really what that means is that it is a disorder of hormonal balance. So in terms of what is happening with PCOS, overall, the ovaries are secreting higher levels of a hormone called, or a whole group of hormones called androgens. The one that we would most commonly think of would be testosterone. And with that, it's causing an imbalance in hormones and in terms of our reproductive hormones. And this can present in a few different ways. So the first way is menstrual irregularity or missing periods. The second would be hyperandrogenism. So that could be clinically, like noticing excess hair growth, noticing excess acne. It also could be showing up in blood work with like hormonal panels being outside of normal range in blood work. And then the third way that PCOS presents is with excess follicles on the ovaries. So there are three kind of criteria in terms of diagnosis of PCOS. And for someone to be diagnosed with PCOS, they have to meet two of these three criteria. So that is a summary kind of what is going on with PCOS in the body. Overall, this can have effects on the day-to-day, like it can affect someone's energy levels, it can affect their appetite and their food cravings, their mood, sleep quality. So it can really have impacts on day-to-day. And then it can also have impacts in terms of long-term health. So someone with PCOS is at risk of developing type 2 diabetes, cardiovascular disease, higher blood pressure levels. So then there are those kind of associated risks in terms of long-term health. And it can also, of course, impact fertility, which is one of the...
Which is what we're here to talk about, really.
Exactly.
So let's talk a little bit about how PCOS impacts fertility specifically, since you talked a little bit about day-to-day, but let's dive deep on that fertility point.
Yeah, absolutely. So when we're thinking about our hormonal balance and fertility, so certain hormones are what are triggering the process of ovulation. So with certain hormones, it's going to be triggering the development and maturation of an egg and release of that egg from the follicle to be fertilized. And so with hormonal imbalances, it can actually lead to preventing that process of ovulation from happening. So it can lead to preventing the process of ovulation. It can also just lead to kind of unpredictability with it. So menstrual irregularity, if someone's cycle is not necessarily regular, it's really hard to establish when someone would be ovulating within their cycle. So it can lead to irregularity as well, both of which can affect someone's chances of becoming pregnant. Whether if they are not ovulating, then they wouldn't be able to conceive naturally, or irregularity can lead to kind of more challenges with that. And it's not to say that someone with PCOS cannot conceive naturally, but it is estimated that about 70 to 80% of women with PCOS will have challenges with fertility and conception. So that is a good portion.
It's pretty high.
Yeah, pretty high, absolutely. And the good news is, though, with that is that PCOS, although it's a very common challenge with infertility, it's also seen as a more kind of treatable option. So more and more research, like I mentioned, is going into this area and how diet affects PCOS and fertility. So we're learning more and more about changes that we can make through lifestyle to be supporting menstrual regularity, to be supporting ovulation, and therefore hopefully we'll start to see that number of women with PCOS being impacted in terms of fertility maybe come down a bit with time and with learning more.
Yeah, absolutely. And so, given the fact that there are certain things that maybe we can change, let's talk about that lifestyle change that we can do, and that is specifically right within your wheelhouse as a registered nutritionist to talk about that nutrition. So, what is the relationship between nutrition and supporting your fertility? Maybe there are individuals that are watching this right now that are thinking, "I'd like to get pregnant maybe in a year's time or in 6 months' time. What is it that I can do to start?" Or maybe I'm looking to have my third child and maybe I should kind of get my ducks in a row this time around.
Yes, yeah, absolutely. So nutrition can impact fertility in a lot of different ways, from, for example, hormonal balances. So the building blocks of our hormones are actually made up of nutrients that we get from our foods. So making sure that we are supplying our body with the right type of nutrition and the right nutrients can really help to be supporting hormonal balance. Also playing into that, and something that we can talk more about for sure because it's a huge topic, is insulin sensitivity with PCOS specifically. So insulin is a hormone that our body produces to help our cells absorb sugar kind of to be used for energy. And with PCOS specifically, insulin resistance is very, very common. So hormonal balance, insulin resistance, all can be supported through diet and dietary changes to be making sure that things are in line with hormones. And with that, when hormonal balance is improved or achieved, that can lead to more menstrual regularity. So the cycle, our menstrual cycle, it's regulated through hormone levels rising and falling at different times throughout our cycle. So with regulating our hormones, with getting that balance in our hormones, a lot of the times it translates into a more regular menstrual cycle, which is fantastic. And that is a lot easier to then be tracking and making sure that, you're trying at the right times in your cycle. And so that's very helpful in terms of nutrition and can help as well. It can also help in terms of improving the lining of the uterus to support implantation. So certain nutrients, a lot of the fat soluble nutrients like vitamin E, zinc is also a mineral that's tied possibly to improving the quality of the lining of the uterus and supporting implantation. So that is another way that nutrition can impact. And it also can impact egg quality because the egg cells are going to be the highest cell in the human body in terms of needing energy for production. So making sure that we are having enough and making sure that we're having the right types of foods to support egg quality is very important as well. So a lot of different ways in terms of conception that nutrition can support really from start to finish and of course into pregnancy. So nutrition really is important in a lot of the processes throughout the journey of trying to conceive.
So if I know that I have PCOS, is there a way, you went through some of the minerals, you went through some of the vitamins as well that are relevant, but are there ways that I can boost my fertility? If I have PCOS from a diet and nutrition perspective, should I be supplementing? How should I manage this maybe?
Yeah, great question. So overall, in terms of diet and PCOS and increasing fertility specifically for PCOS, so as I mentioned before, there's a ton of conflicting nutrition information out there in terms of PCOS, and navigating it can be really, really challenging. So overall, I always encourage aiming to make sure that we are having an overall balanced diet. So what does that mean? That means that all foods can fit in moderation, first of all. So I encourage making sure that we're having a really wide range of different foods, a really good variety of different food options to be supporting our health and to be supporting our relationship with foods as well. But when we're thinking about PCOS and fertility specifically, we're kind of thinking about menstrual regularity. We are thinking about egg quality as well, and we're thinking about hormonal balance. And this is where the insulin resistance kind of piece really comes into play. So 70% of women with PCOS have or show that they have signs of insulin resistance. And really what insulin resistance is that the cells, like I mentioned, they kind of have, you can think of it like a door on them. And we need a key to come and unlock that door so that the door can open and the sugar that our body uses for energy can go inside of the cell to be used properly. So for someone living with PCOS, their insulin is, for whatever reason, it's not quite working properly like a key to open that door. So their cells are kind of losing sensitivity to insulin, we say. What our body does then to compensate is your body will start to pump out more insulin in the bloodstream to try to make it work better and to try to really make sure it is doing its job. And then what happens with higher circulating insulin levels is that high circulating insulin levels actually leads to higher production of testosterone. So it's kind of playing into this cycle of then increasing androgen production as well, which can exacerbate our PCOS. Yeah, so it's a cycle. So from a diet perspective, we want to address that underlying cause. We want to try to address the insulin sensitivity. We want to increase your body's sensitivity to insulin. So through diet, we do that in a couple of different ways. I know this is a long answer to get to actual diet recommendations.
No, that's okay. And I think, it's good for us to build this base and build a foundation so that the viewers can understand it. It is a complicated process, and you don't just simply make a recommendation based on just a quick, head to toe. So I'm very happy that we're really building those building blocks so that everyone can understand kind of the science behind it and what it is and how we can manage it.
Yeah.
I'm actually going to jump into a question here that one of the viewers asked, and then we'll kind of go back to our normal line of questioning. Okay. The viewer asks, do any of these lifestyle or diet changes, do they differ for those of any older reproductive age? So if I'm maybe over 35 years of age, I have PCOS, and I'm trying for my first or maybe other child.
That's a really good question.
Yeah, great question.
My diet recommendations would not really vary a ton, but supplement recommendations may. Because with aging, we see more often lower egg quality in terms of fertility. So certain supplements might be helpful in terms of improving egg quality. That being said too, with any diet changes, with any supplements, it does take time for them to have an impact on fertility. So we say 3 to 4 months at minimum. So for example, CoQ10 is a supplement that it can be taken to support fertility in any stage, but it would especially be important in later ages because of the role it plays in egg quality and supporting that.
Okay. Now let's talk about maybe foods that we should avoid. You talked about how there should be a wide range of foods that we should incorporate into our diet throughout even our various ages. But are there certain foods to avoid for someone with PCOS who is trying to conceive?
Good question. So as I mentioned, all foods in moderation. I am someone who practices from what we might call like an anti-diet or like an all foods fit approach. Meaning really that we have to find that balance in order to have like a healthy relationship with food and support our fertility. One thing that plays a huge role in fertility outside of diet as well is stress. And when we are spending so much time, with thinking about foods that we can't have or certain nutrients that we have to avoid, that can really take a toll on our mental health. And people living with PCOS are also more prone to mental health challenges and mood disorders, as well as disordered eating patterns. And so I really encourage not focusing on foods to be avoiding in terms of PCOS and fertility, but instead an additive approach. So what foods can we be adding in to be supporting fertility? There are no foods that will make or break someone's chances of getting pregnant. So there are no foods that are, complete no's in terms of PCOS, aside from the ones that we would say in terms of anyone trying to conceive, like limiting alcohol, being conscious of their caffeine consumption. But there are no specific foods to PCOS that I would say to avoid. Instead, I say take an additive approach and work towards that pattern of balance that isn't going to add extra stress and extra kind of pressure into your eating pattern. With infertility, there's so much pressure and stress on a couple, and specifically, unfortunately, on women in general, that we want to try to do our best to take that off in any area that we can. So I encourage not adding it from diet, no food specifically to avoid, but definitely we can talk more about foods to add in as well.
Yeah. So before we talk about what types of foods we should add in, a viewer sent us a question a couple days ago that said, I've heard that low carb diets are good for optimizing reproductive outcomes. Is this true?
Very good question. Yes. So it is not necessarily what I would be encouraging. So low carb diets are recommended for a lot of various reasons right now, from fertility to a lot of other health conditions or concerns. It's a little bit of kind of the focus, I would say, in like the wellness atmosphere is following a low carb diet. Overall, as I mentioned, egg production is one of the most, it has the highest energy requirements in terms of any other cell in our body. So we actually really want to be fueling fertility with carbohydrates because carbohydrates are your body's first choice for energy. They're going to be the easiest to be broken down, and every single cell in your body can use them for energy. So I don't necessarily emphasize a low carb diet, but instead focusing on the types of carbs that you're having. So types of carbs that you're having, this again, it ties into the insulin resistance component. And that is why I think there's such an emphasis on low carb with fertility, is because we want to address that insulin resistance. However, when someone isn't fueling their body with the right nutrients for fertility, even if it addresses insulin resistance, if we're missing key nutrients, key components from those carbohydrates, it can affect not only ability to conceive, but also it can affect early pregnancy outcomes. So we want to make sure that we are fueling with carbohydrates and focusing instead on the types of carbohydrates that we're including in our diet.
Okay, absolutely. So let's talk about some of those vitamins, if we're adding things to it as well. What vitamins should someone with PCOS take while they are trying to conceive?
Yes, good question. So of course, general prenatal is a great option to be making sure that kind of your bases are covered in terms of your nutrition needs. And with that, folate or folic acid will be part of that. Vitamin D is another one that will be included in some level in prenatals. However, it's often lower than what we would be recommending specifically with PCOS and fertility. So sometimes taking a separate vitamin D supplement is really, really helpful. Vitamin D can play a role with menstrual regularity, can play a role with hormonal balance. And if someone is low in vitamin D, it can really affect their fertility in terms of PCOS specifically. So general prenatal for everyone, of course, including that folate or folic acid. Vitamin D for everyone, but it might be a higher need for someone with PCOS. And then two really specific ones that we talk about with PCOS and fertility and supporting fertility. One of them is a supplement called Inositol. So Inositol can help with egg quality, can help with hormonal balance as well. It is found in some foods, so things like nuts, legumes, berries. So it is found in some foods, but taking it at a higher concentration in a supplement form may be helpful for fertility.
Okay.
The other one is called NAC or NAC or N-acetylcysteine. few different names that you might see on the bottles. And that is another one that can be really helpful specifically for PCOS and fertility. Again, plays a role in hormonal balance and menstrual regularity and egg quality. So supplementing both of those, if you have PCOS and you are trying to conceive, is really helpful, as well as the regular prenatal and vitamin D as well.
Great. Thank you so much. A viewer asks us, do nutrition recommendations vary between those insulin resistant PCOS patients and the non-insulin resistant PCOS patients? Thank you so much for asking.
Yes, good question. Good question. So overall, there will be more with insulin resistant PCOS patients. There will be more of an emphasis on what we call lower glycemic index carbohydrates. So those are carbohydrates that affect our blood sugars less. So things like quinoa, sweet potato, whole grains, any of those whole grain options are really great, and will be more of an emphasis in terms of insulin resistance with PCOS. But overall, anyone living with PCOS likely has experienced challenges with appetite regulation and sugar cravings and food cravings throughout the day, and fatigue and energy levels. So as much as those lower glycemic index carbs can help specifically with insulin resistance, they're also really helpful for those other symptoms of PCOS. So we want to have a lot of those whole grains. We want to emphasize having those whole grains that are lower glycemic index, rich in fibers. We'll have a lot of trace vitamins and minerals as well, which is great. Yeah. We want to have lots of lean proteins for both insulin resistance and non-insulin resistance. Again, to help with appetite regulation, to help with energy levels throughout the day. Making sure that we include lean proteins with the meal is really, really important. Filling up our plate with lots of vegetables to increase our fiber intake. So those recommendations would be consistent. There would be more of an emphasis on low glycemic index carbs with insulin resistance though.
Great. Well, thank you. That was just such a thorough response, and I'm sure our viewers are really appreciating that. Brady is quite an expert, and we're very, very happy to have her on today. Let's talk a little bit about diabetes. And this can happen. Is it more likely for women with PCOS to also develop gestational diabetes during pregnancy?
Yes, great question. So yes, women who have PCOS are at higher risk of developing certain pregnancy-related complications, such as gestational diabetes or preeclampsia. So absolutely, it is something to be mindful of in going into pregnancy that, you know, with conception, healthy lifestyle habits kind of don't end there for sure. And I guess it goes to speak to my overall approach as well in terms of thinking about sustainable changes. And we really want to make changes that are sustainable for our long-term health. And we're kind of looking at the bigger picture. And so with that being said, yes, you are at higher risk of developing gestational diabetes. So you want to continue to really be mindful of diet and lifestyle factors going into pregnancy as well. So continuing with the healthy eating habits that I mentioned in terms of managing PCOS, continuing with regular physical activity as well, those can both be steps that can help to reduce the risk of developing those pregnancy-related complications. Someone with PCOS, even though they are at that higher risk, they can still have a completely healthy pregnancy and have no complications come up. But it is best if we are kind of, you know, mindful of that and put that effort in with lifestyle. And also keeping in mind that if someone with PCOS did happen to develop gestational diabetes or preeclampsia, you know, they also could be following a perfectly balanced diet, and it is just the way that their hormones are interacting in pregnancy. So also knowing that you didn't do something wrong if you do develop gestational diabetes or preeclampsia is really important. But doing your best to put that effort in to reduce that risk is absolutely important. Yeah.
Fantastic. We have some great questions that we've gone through, some great topics that we've discussed. She's been able to establish really the foundation of what it means to have PCOS, how it impacts fertility and nutrition. So let's talk about, is it possible to manage PCOS while pregnant? So now we've gotten over the hurdle of fertility, we've conceived, we are pregnant, but how do we manage our diet and nutrition while we're pregnant and have PCOS?
Yes, absolutely. And so again, that just goes back to we want to make sure we are following those healthy lifestyle recommendations. If we are thinking about kind of how we want to be balancing out our meals, I would say it's consistent with PCOS and trying to conceive going into pregnancy. Just keeping in mind that with pregnancy, with PCOS and continuing hormonal balance throughout pregnancy, our energy needs in pregnancy for anyone increase. And so keeping in mind that I always encourage listen to your appetite, because that is going to be the best judge of how much we should be eating in pregnancy. And
Yeah.
it is especially important with PCOS and possibly that insulin resistance affecting appetite regulation. So doing your best to eat mindfully in pregnancy, making sure that you're having enough to actually truly satisfy your appetite so that you don't feel hungry sooner than 3 or 4 hours kind of between meals. You want to really and truly satisfy your appetite with meals and snacks that you have. But it is absolutely possible to manage PCOS in pregnancy and have a healthy pregnancy. Just continuing to follow lifestyle recommendations of diet and activity are really, really helpful for managing that.
Absolutely. One of our last questions that we have, I know we were going to talk about nutrition, fertility, and PCOS, but a viewer had sent us a question regarding lactation. And I think it's still really, really important that we go through it, because you can have PCOS, baby has arrived, now we're breastfeeding or chest feeding. Will that be impacted? Let's talk about the nutrition associated to breastfeeding, chest feeding, lactation, and PCOS.
Yeah, absolutely. So main considerations with breastfeeding, with lactation, in terms of nutrition, would be making sure that someone is getting enough in terms of how much they're eating. So again, it goes back to that appetite piece. It's so important. We have become out of tune with our appetites for so many different reasons in today's day and age. So trying to do our best to tune back into that, because with breastfeeding, if someone is exclusively breastfeeding fully, then their energy needs are actually higher than even throughout pregnancy. And so making sure that you are listening to your appetite, having more food on your plate, because you're needing more energy to be supporting milk production. So that is really important. Generally, that can look like having one extra kind of large balanced snack than what you would typically have prior to pregnancy. So that will be a little bit different for everybody, and that is why I would say listen to your appetite. If you are feeling really hungry when you're trying to breastfeed, then it's a sign that your body is not necessarily getting the right balance of nutrition, or you're not eating enough. So at that time, it can be really individual, and speaking with a registered dietitian can be really helpful to notice, okay, where might there be gaps in terms of how you're eating, or are you meeting your energy requirements through diet? The other really important thing to be supporting lactation and breastfeeding from a diet perspective would be hydration, and making sure that you're meeting your hydration requirements, which can be really hard. Hydration and energy requirements can be really hard as a new mom when you are managing thousands of different priorities that you've never faced before. So making sure that you are trying to be conscious of your hydration needs as well. Keep a water bottle around so that you can stay really well hydrated. Typically, in terms of breastfeeding and lactation, you'd be aiming for about 10 to 13 cups of fluid in the day. So it is quite a lot to be drinking. So keep that water bottle around always and try to sip throughout the day. Those are the two main considerations that we'd be thinking about would be, are you having enough to eat to support your breastfeeding needs? And are you drinking enough in terms of hydration?
A really good reminder, especially when your lifestyle just ends up changing so much when you bring baby. This is not the time to start restricting and to eliminate or to minimize, right?
That's a really, really good point. I'll just add into, because overall, a lot of the times with postpartum, and it can happen at different stages for different women, but we do feel that pressure to return to, our pre-pregnancy body or anything like that. And if you're trying to breastfeed, that can be really, really, it's a challenging balance for sure. It's a challenging balance anytime, whether you're breastfeeding or formula feeding, because there's so much pressure associated with it. But definitely take the time to nourish your body, take your time to make sure you're satisfying your energy needs, because your body, it just went through a huge change. You're supporting recovery postpartum as well in terms of healing your body. So it's definitely not the time to restrict. It's time to have lots of self-compassion. It's time to enjoy foods, and it's time to make sure that you're satisfying your appetite for sure.
Well said, especially to have that self-compassion. You know, you have just made a massive transition physically, physiologically, emotionally, mentally. You're in a new stage of your life. So lean on experts like Brady Hutton, who are there to help and support you and your family and your new little one that has just joined your own family unit. Brady, it's been a pleasure to chat with you today. We are so happy. We went through so many incredible topics. We thank you for all of the viewers who joined us today. If you have further questions and want to get connected, please feel free to like and follow this video. Feel free to like and follow Push Mama Care, Brady Hutton, as well as Grow with Treehouse. If you like videos like this and you like interview styles like this and want to learn more, feel free to even reach out and give us some other topics that you might want to see more on this channel. So thank you so much to Brady. We're very happy and grateful to have had you on, and we look forward to doing it again.
Yes, thank you so much for having me.
Thank you everyone for joining, and we'll see you soon. Bye everyone.